Good afternoon, North Dakota. I hope that everybody tuning in had a fantastic 4th of July celebrating our amazing country. And I also know that had reports of lots of people that were smart about how they practiced great individual responsibility or collective responsibility within their families or their social groups over the weekend. So again, thanks all for doing that. During the last press conference, we talked about how important it is to know your status. I mean, to get tested before you have contact with vulnerable populations, take advantage of the multiple free testing opportunities when it's available. And of course, over the last couple of weeks since our last press briefing, we've continued to have great success in terms of driving testing in North Dakota and even over the 4th of July. So if we look back over the last 3 weeks, we were just over 23,000 tests per week for the last 2 weeks in June, and over this week, over the last 7 days, just under 23,000. So even over the 4th of July, although we're a little bit lower on the 4th itself, but with big testing days leading into that, we've managed to keep up that rate now at our highest rate since the pandemic started for 3 weeks. So almost 70,000 tests completed in the last 3 weeks. And that only happens with great efforts by the teams that are out working, collecting the tests, local public health, our health providers, North Dakota National Guard, local community leaders, but citizens themselves that are being proactive and saying that they want to get tested, even if they may not have symptoms, but they want to know their status and be part of the solution. So again, this is really important, particularly now that we get in the summer season. We've got more travelers coming to North Dakota, lots of people road tripping this summer as part of those experiences. They're trying to get to places that maybe have got lower positivity rates like North Dakota, South Dakota, Montana, or Wyoming. So we're seeing some very good tourism traffic coming through our state. And we know that this is the time during the winter people migrate north to south. During the summer they migrate south to north, and we know that the Sun Belt states, Arizona, Texas, Southern California, and others are really being challenged right now by increasing rates. In Texas, for example, and it started out in June with a positive rate of 4%, and they 14% near the end of the month. But what we're also seeing is a shift in this during the summer too, is the average age of those infected. For example, in Texas, the COVID cases were 60 plus in the March-April timeframe. Now the average age of the case is in the 40s, so it's dropped by a generation, almost 20 years. We also are seeing a drop in the average age of a test positive in North Dakota. Because of this surge that's happening, I'm sure everybody's been watching the national news that many states that had begun reopening processes are now back closing bars, closing personal care services, reducing capacity at restaurants, closing beaches. These states are experiencing resurgences of varying degrees. We need to remember that we can't get complacent here. North Dakota's not immune, but it also does not have to be our fate in North Dakota. We are fortunate that we've not seen any major resurgence of the COVID. However, in recent days we've seen an increase in number of active cases that are reported daily, and so this is something we need to pay attention to. Today in North Dakota, there's 439 active cases, and this is nearly double the number of active cases 2 weeks ago, and returning to those levels that we saw at the end of May. But again, part of the reason why we're seeing an increase here, it's not necessarily a big increase in the positivity rate. As I stated at the outset, we are doing more testing. With more testing and good contact tracing, we can do a good job of finding the cases, which is we're wanting to do. But then when we find these cases, these active cases, we want to make sure that we're getting them isolated and making sure that they're not spreading more. One of the good pieces of news, however, among those 439 active cases, only 15 of the 439 active cases are residents in long-term care, and we've made it a huge priority in our state to not only protect lives but also livelihoods. But the people that are most vulnerable of this are people that are that have both age and underlying health conditions, and those folks often are found in long-term care settings. So again, only 15 of the 439 cases in long-term care. That's a fantastic number. So thanks to everybody who works in long-term care, and thanks to Chris Jones and his team and all the folks that have been doing such a proactive job of reopening visitation when we get the case numbers down. We've done that, and this is helping us. Having those low case numbers is helping us reunite families with their loved ones. As you see on the slide we have right now, the positive rate of completed tests is ticking up slightly. We got down below 1% on the 14-day rolling. This chart goes back to June 1, but we are 14-day rate, we're at a 1.4%. The last 3 days we've been above 2%. That's what's pulling this 14-day trailing number up. But again, one standard when we look at this thing, well, we want to pay attention to it. We want to be alert. We want to do our job here, and all of us that are in the all those that are involved in public health to make sure that we ourselves are not getting complacent. We're paying close attention. But I should share that one standard that is being used around the world is that they're looking for places to be under 5% with adequate testing for 14 days. And we have been under that standard. North Dakota has been under that level for months and months. But even as we sit here today, there are 28 states out of 50 that do not meet the standard of being under 5% with adequate testing for 14 days. So as we've talked about, North Dakota is well positioned, and we were well prepared, and we want to just keep going, keep the string rolling that we've got going here. And again, that's a team effort that requires everyone. When we take a look at the last 7 days of testing, we've had 360 positive cases in the last 7 days. Again, this is a 7-day number, but it's a 1.5% positive rate over that time period. As I mentioned, part of this is pulling up where we were. We got actually below on the 14-day rolling a few weeks ago, below 1% positive, which would have been best in nation type performance. We have pulled it up a little bit because we've had a couple days here of where we've topped just over 2% on the positive rate. And so again, when you're this low, there's not much place to go, but we want to keep it low. And we're very fortunate to be in North Dakota, to be in our position. But again, we want to make sure that all of us together continue to remain vigilant as we work together to avert this threat that we have to both our economy and to lives. And so again, I want to say thanks to all North Dakotans who've done just an excellent job. When we take a look at serial testing here, which we've talked about before. In the blue on the top of this, these are individuals who've been tested once before and are being tested again. And then the gray on the bottom are people that are being tested for the first time. It's positive that we're seeing that number climb over the last few days, that individuals that have not been tested before are coming forward to get tested. That's positive as we sort of reach more North Dakotans. Altogether, we've done 208,192 tests. I just make a note because we are starting to understand more how states do the reporting, including having conversations last week with the governor of Rhode Island, who's always been the top of the leaderboard with their number one position. They count all the PCR tests, meaning all these 208,000 tests in there. If North Dakota was submitting our data nationally the way Rhode Island is, we would actually be in the number one spot in terms of tests per thousand at 27,000 tests per 100,000 folks. So again, thanks to everybody involved in the testing efforts in North Dakota. This last week, if we go for a 7-day, we did 8,000 613 newly tested North Dakotans and 14,800 repeats. And sometimes people ask, why so many serial tests? Well, we do have, again, a commitment to test people that work in long-term care at least weekly, because that's the way we protect those residents and keep those numbers down. And then also just in traditional health care outside of long-term care where people are getting exposure, a number of those folks are also being tested on a more regular basis. And so that's where you would see some of that serial testing occurring. When we do the net case breakdown, again, as we mentioned earlier, 439 active confirmed cases, but we should also note there that big number, 3,447 individuals have recovered. We do have, sadly, 85 deaths, which over the last week included 5 individuals, a woman in her 90s from Cass County with underlying health conditions, a man in his 50s from Cass County with underlying health conditions, and a woman in her 70s from Cass County with underlying health conditions, and a woman in her 90s from Cass County with underlying health conditions. But also part of this group was a woman in her 80s from Stutzman County who had no underlying health conditions, and that's the second case recorded in North Dakota where someone has passed with COVID without other underlying health conditions. So again, our thoughts and prayers go out to the families of those who've lost a loved one during this crisis. Currently, of course, one of the things we've been trying to manage throughout this whole process is our hospital capacity. At our peak, we had in the low 40s in terms of number of people who are hospitalized. Currently, 26 people are hospitalized. Our peak hospitalization in the 40s in terms of individuals occurred after we hit that peak number back in May in terms of peak number of active cases. With our active cases going up, it's possible that we would see hospitalizations continue to climb some in the days ahead, but not a certainty, because one of the things in the Sun Belt states, as their cases have increased, in some cases their hospitalizations have not, and that's again correlates back to the fact that more of the positive cases may be among the young and the healthy who do not need hospitalization as they work through their course of experiencing COVID-19. One thing we want to drill down a little bit deeper on today is Burley and Morton County updates. And again, I think those are names that are well familiar, but for across the state, Burley would be, of course, the county for Bismarck. Morton is the county across the river for Mandan. And right now, Burley County, at 128 active cases, has got the most active cases of any county in North Dakota. That's was the case in the very, very beginning, as people might remember when we first began this these COVID discussions back in March. It sort of started out here in Burley, but we've gone for a multiple month stretch where the eastern part of the state, Grand Forks for a while, and then for several months, Cass County was the leader in active cases. But now Burley takes that label. In response, we have stepped up testing in this area. People know that we've been working to better identify and trace positive cases, and there's been great work done here on this side of the river, on the east side of the river, with the Bismarck-Burley Public Health. Morton County and the surrounding counties are served by Custer Health Public Health, which serves a multi-county region. They've also been doing a great job, and we are trying to apply here a number of things that we've learned, working in conjunction with the state, the federal, the private providers, and local public health and local political subdivisions through the Red River Valley Coronavirus Task Force. We're trying to bring those ideas and those learnings back here. Again, just some more math for people, because you never get enough during these briefings. But Cass County represents 24% of the population. Almost a quarter of the state of North Dakota resides in Cass County. Burley and Morton combined together, 16.7. And so again, when we talk about these two areas, we're talking about just over 40% of the population of our state. But as you take the two counties together, Burley, Morton at, call it 16, Cass County at 24, then if you had the same equal number of prevalence in both both those metro areas, we would expect that Cass would have about 50% more cases just on any given day because there's 50% more population there. But in the last 2 weeks, we've had the Burley-Morton case numbers have exceeded the Cass County 4 days in the past 2 weeks, and including the last 2 days. And so there has been an inversion here where this metro area has moved ahead of our largest metro area. And so again, that's a cause for to say congratulations to all those involved in Red River Valley Coronavirus Task Force for arresting and slowing the spread in our largest metro, but we want to make sure that we keep the numbers low here in Burley-Morton. So we're continuing to monitor the situation, and if we need to take steps, including more formally putting together a task force, we will, but at this time, we believe we can just manage it through the relationships and the local public health and the state coordination, which we have right now. And again, for perspective, if people are thinking that we're not being proactive enough, at the time we were looking at the Red River Valley Task Force, the positive rate in Cass was 8.2, it was 7 in Grand Forks, the statewide rate was 3.4. Today, Burley County's positive rate is 2, the statewide rate is, trailing rate is less than that. And so again, as you can see, again, thank you North Dakotans and everybody involved in public health, because what we're seeing as an increase here in Burley and Morton, we're starting from a much lower point and a more manageable point, and we've got more testing capacity, we've got more contact tracing capability, we've got more knowledge about that. The other point of note, as we see these cases rise in Burley County, we know that if what's partly different this time is that when they were rising in Cass County, we did have a series of infections that were spreading through long-term care with the great work we've done on the V3, the vulnerable population, VP3, the vulnerable population protection plan. We have been able to protect, as I said, we've only got 15 positives among close to 10,000 residents in the state in long-term care, which is again fantastic. Burley County benefited, as did other parts of the state, from the work of the VP3, and Burley County has not had a single death recorded yet from COVID-19. Morton County has only had 2. Conversely, Cass County had 70 of those deaths, and many of those deaths came from nursing homes. So 70 of the 85 deaths recorded in North Dakota were in Cass County. We're trying to, again, reduce the number of fatalities because of the work that we're doing to protect the most vulnerable, and we believe we can certainly do that with the plans we have in place. We are doing a lot more testing in Burley and Morton as part of this work. The last 2 weeks of June, first week of July was our highest amount of testing here. We completed 2,114 tests in the 2 counties during the first 2 weeks of June. In the first week of July, we did close to 5,000 tests, and so that is again, we've increased testing, but the increase in percentage of positives also went up over that time frame. So again, we want to make sure that as we are working through this thing, that we want to make sure that we're continuing to expand testing sites that are available. And again, we're going to work with local public health, North Dakota National Guard, Department of Health, to expand testing sites. These sites are going to be available around the state. You can go to the North Dakota Health website, where to get a COVID test, for more information. And mobile testing will be taking places in cities around the state as well. And I'm going to rip through some of those quickly, but Dickinson tomorrow, Thursday, July 9th, and then we've got tribal partnerships continue to move forward. Standing Rock on Friday, July 10th, Spirit Lake on July 14th, Turtle Mountain on July 15th, and then back up in Grand Forks also on July 15th. And you can visit, again, the North Dakota health.nd.gov/where to get a COVID test for more information. We are also adding, those are, we call those mobile sites because the team moves around and we set up in parking lots and you can walk up or bike up or drive up. But when we talk about a static site, we are talking about a physical location that's going to be established. Other states have done this. We think it's a good practice. We want to put them in places where where people can get access to them easily in their communities, and they'll be operated by local public health units with support from North Dakota National Guard and the North Dakota Department of Health. And we've got more plans will be announced, but currently by July 15th, we're going to open up a static site in Dickinson, July 20th in Williston, Minot, Jamestown, Bismarck, and Devils Lake, and then still working on announcement dates for Fargo and Grand Forks. But again, there are other locations in all of these cities, including all of our healthcare providers, where we can get tested. I want to also talk about some other things just from as we work to get more efficient on the testing. We're happy to announce that the North Dakota Department of Health initiated the first round of e-notifications by email or text message. It was a traditional practice in contact tracing that if someone came back negative, that they wanted to call that person and make sure that for not violating any HIPAA laws or anything like that, that they were talking to that individual. This resulted, of course, in thousands. If you're doing 23,000 tests and most of them are negative, a lot of call volume. We are now giving people who get tests, individuals have an opportunity to opt in to receive a text or email if they're negative. Individuals who test positive are still being notified personally by a phone call from a health official and are getting that done within 24 to 72 hours. But if an individual tests negative they have an opportunity again to opt in for this e-notification, and we started doing that last week, and that's going to help us save on a lot of labor costs because again we want to do testing, we want to do it as efficiently as possible. So another exciting technology solution that'll help automate a highly labor-intensive effort, and it'll benefit citizens in getting notifications sooner. In closing out this section on testing, I do want to also say too that we unfortunately are still hearing reports of individuals who are presenting themselves at healthcare facilities, sometimes evenings or over weekends, that have been denied testing. And so we're going to be reaching out systematically to all of the healthcare providers in the state to find out if there are things that we can do working together to try to solve this problem, because we do have verified reports of individuals, one individual, male, age 70, been sick for 5 days, presented with symptoms, was turned down in 2 different locations. And again, I just want to say that's not acceptable given that we're in this emergency situation. And so we want to make sure that that we understand the situation, we understand what's happening. And this is different than I understand that if a 22-year-old healthy individual walked into an emergency room and said, hey, I want to get tested, the health provider might say, look, we've got other people to care for, we've got insurance complexities, we've got other issues. But so I'm saying, understand, healthcare is complex in our country. But if we have individuals that are presenting that have symptoms and are of age, absolutely positively, we want to make sure they're getting tested. Let's get the test collected. If a hospital organization is wondering how they're going to get that covered, call the state. If an individual gets turned down and is denied testing, then we'd like you to call the hotline. I think they're going to put that number up right now. But again, we do want to hear, stories and situations and experiences of people who are symptomatic, are unable to get testing, because we're trying to make sure this is it's not only the right thing to do for the individual who may be sick, it's the right thing to do for the community and for the state to make sure that we're identifying positives as quickly as possible so we can get them isolated and slow the spread. And so again, by giving that test, we might be saving that person's life and maybe other people's lives. So again, we want to be able to get tests to those that are tested. So again, our hotline, 1-866-207-2880 from 8 a.m. to 5 p.m. Monday through Saturday. If volume picks up, we'll expand the hours again on that. But again, please call us or call us right now if in the last few days or over the holidays you're unable to get a test when you wanted one. And again, these static sites that I just talked about and the mobile sites, those are all free. So if individuals want to know their status, pay attention to those locations. And I believe that was again the health.nd.gov where to get COVID test on the website. Also, if you're planning to go to one of those sites, there's on that same site you can go to North Dakota Health Test Reg and you can register ahead of time, and that'll speed up your time when you're there. Closing out all of this on the COVID front on the health side, I want to remind and thank people again about North Dakota Smart. All the government rules, regulations, executive orders combined cannot stop the virus from spreading between individuals. We as humans are the carriers of the virus, and the way it spreads human to human right now is when people don't wash their hands, they are in too close of contact with someone, they may be coughing, sneezing, those kinds of things. So there's very simple things that you can do to maintain your activity, protect your loved ones, keep your life going, keep your business going, and restore customer confidence. And that's very simple, which is the simple things that work, which is hand hygiene, keeping physical distance, and when appropriate, wearing a mask. Those things. And then, of course, if you're a business owner, cleaning and disinfecting services is another great way to slow the spread, particularly between as customers come and go. So again, some very basic, simple things we can build into our lives that allow us to save lives and livelihoods, and we're doing a great job of that in North Dakota. It shows in all the numbers. So again, thank you for being North Dakota Smart. Let's keep it up, and as if other states are having to close down, let's be the one that keeps opening up. We can do that working together. Next up, and the topic is about economic support. We've talked in the public health section we just covered, we're talking about saving lives. We want to talk about saving livelihoods. And our goal throughout this has been, through COVID-19, has been to do both. And to start off, I want to, again, just share my gratitude because I've been in contact with all of these folks this week, again, as we often are, but Senator Hoeven, Senator Kramer, Congressman Armstrong, all doing a fantastic job on representing our state to the federal government and working to craft federal legislation during these challenging times. And again, we've had during an interim between sessions, we've had unprecedented collaboration between the executive branch and the state legislators. I want to thank all of the state legislators, the members of the budget section, emergency commission members, including our Secretary of State Jager, and the legislative leaders that serve on that. All working together, and of course, all of our great healthcare providers across the state, local public health, citizens themselves, businesses. I mean, it's been a great time of collaboration in our state. But from a federal standpoint, the only one among us that actually has the ability to literally print money is in providing stimulus into the economy of our nation during this time of demand shocks and trying to arrest a global pandemic. But North Dakota, at a minimum, we know there's at least $4.5 billion that have come into the state. We know the $1.9 billion through the SBA programs that touched over 19,000 businesses. The $1.5 billion that the state received from the Coronavirus Relief Fund, which we're working with the legislature to distribute in the most strategic way. There's about $600 million in other federal programs, and then of course hundreds and hundreds of millions of dollars in terms of checks that went out to individuals and families through the direct payment. And then on top of that, of course, all the money that has gone into supporting individuals through the dramatically enhanced unemployment insurance. So anyway, lots and lots of federal support. This makes a challenging time for trying to forecast the economy because this amount of stimulus, is it being saved? Is it being spent? Is it being circulated? those are things which, again, make this a very challenging time. Of the $1.25 billion from the Coronavirus Relief Fund, $930 million of that has already been allocated. And just in the last 2 weeks, since we were here at the podium, working with, again, the Emergency Commission and the budget section, $27 million for public health and safety, $68 million for the continuation of government services, over $200 million more going to economic support that's being paid out through unemployment insurance, and approximately $112 million for economic support of businesses of all kinds across the state. All of these funds have played and will continue to play a crucial part in our COVID-19 response and recovery efforts, and I do know that one of the things that, whether you're a business or whether you're in government, there's an opportunity to think about how we reinvent our approaches to serve citizens better and do that at lower cost. And so, again, this is also, during this period of crisis, it's always also a period, I think, of some opportunity for us to think about how to transform our approaches, whether it's in education, whether it's in healthcare, whether it's in behavioral health and social services. All of these things, we've got an opportunity to do things differently, and we're certainly committed to grabbing this opportunity to help make government more efficient and more effective going forward. Today we want to talk about a new program launching soon, which is going to work on this very important component of restoring consumer confidence, and it's going to support economic recovery. On June 25th, following approval by the Emergency Commission a few days earlier, the legislature's budget section approved the Economic Resiliency Grant, or the ERG program, which will be developed and administered by the North Dakota Department of Commerce to assist North Dakota businesses with COVID-19 response and recovery efforts. And again, we're grateful for the legislators' support of this program and our Commerce team's thoughtfulness in developing this. I know that the Commerce team talked to business leaders and small businesses and business owners across our state. Literally from day one, they've been in contact, and this program was developed with a tremendous amount of citizen input. And here today to speak more about the ERG program is our guest today. We're pleased to have Commerce Commissioner Michelle Kommer here to talk about this. And as she comes up, I want to also thank and share gratitude for Michelle, for her team and the Commerce team who've been working so tirelessly throughout this from the beginning of COVID-19. Their high-quality, dedicated work has supported North Dakota businesses and our economy. She traveled with me to the White House, did a great job presenting in front of the President and the cabinet members that were there. And she also, of course, her team has been deeply involved in all of the North Dakota Restart guidelines, which are guiding us through a very successful restart. So again, Michelle, thanks for being here, and thanks to you, all your team, for all you're doing.
All right, Lindsay, are you ready? Hi, my name is Michelle. Lindsay inspires me. I am pleased to announce a grant that will be available to North Dakota businesses later this month, and thank you, Governor Burgum, for that very gracious introduction. The Commerce Department has been working incredibly hard, and it's a pleasure for me and an honor for me to work with such a dedicated team. So before we get into the Economic Resiliency Grant, I want to remind North Dakota businesses that if your business was financially affected by COVID-19 and you have not availed yourself to the Paycheck Protection Program, recently that deadline was extended to August 8th, as roughly $130 billion remains unspent of CARES Act money. The PPP, as a reminder, is a loan that can be used for employee payroll and related expenses and certain operating costs. It's forgivable under certain circumstances. And in fact, the Paycheck Protection Program Flexibility Act that became effective less than a month ago relaxed the requirements for forgiveness, making it even more appealing to businesses. The PPP is made available to you through your local lender. You can learn more about that and the Paycheck Protection Program Flexibility Act at ndresponse.gov under COVID Resources, Businesses, and Employer tab. And you can also get assistance with the PPP loan and forgiveness application through your local Small Business Development Center, or SBDC, where you can learn more at ndsbdc.org. All right, on to the Economic Resiliency Grant, or the ERG. The ERG, as Governor Burgum said, was designed by the Commerce Department in response to businesses' needs to promote economic resiliency for our state. The ERG is a grant made possible by the CARES Act, which is prescriptive in identifying allowable uses of funds. The Commerce Department's ERG proposal aligns tightly with those parameters. The proposal, as Governor Burgum said, was approved by the budget section on June 25th. As we know, North Dakota's economy has been significantly affected by a drastic reduction in oil prices beginning in the early spring and shortly after a global pandemic hitting North Dakota in mid-March. May's unemployment rate, the most recent available, was 8.6%, down from 9.2% in April, which is the fourth lowest in the nation, and we are seeing other positive trends. North Dakota was recently named the top 10 job markets to have weathered the pandemic by Money Rates in June. As of June 27th, North Dakota had a total of 33,645 continued unemployment claims, which is a 25% reduction from just 1 week earlier. Consumer confidence in the West North Central region, as measured by the June 2020 Consumer Confidence Survey, shows a moderate increase in June, but is still well below pre-pandemic levels. And while the federal government has made billions of dollars available through the CARES Act to individuals, small businesses, healthcare systems, and other important sectors of our economy to mitigate the impact of the pandemic, financing gaps continue to exist, as well as the consumer reluctance to re-enter the marketplace. The ERG was designed to address those gaps. At the North Dakota Department of Commerce, we talk to businesses every day, all day, and when we have asked, what do you need? The response that we heard was this: margins are thin, we don't need additional debt. We need our customers to come back to the marketplace. So the ERG was designed to address that challenge. How do we get customers back into the marketplace safely? This is ultimately the most sustainable path to economic recovery. And the answer to that is consumer confidence, confidence that the marketplace is safe. Getting consumers back in the marketplace also helps people get back to work and reduces the burden on the unemployment insurance system. And it shows the rest of the nation that North Dakota is serious about being open for business safely. So in addition to the important practices that Governor Burgum mentioned, social distancing, mask wearing where social distancing is not possible, and hand washing hygiene, this grant money will be invested in improvements to help control the spread of infection, to inspire consumer confidence to return to the marketplace. So how much and when? There is a $66.4 million available for grants to eligible businesses for up to $50,000 or $100,000 where the business has more than one physical location to make improvements in facilities, business systems, and equipment or supplies that reduce the spread of infection. Recognizing that companies have been proactive in making these investments, the grant may be used for expenses dating back to March 27th, which is the date the original CARES Act was passed, through December 29th of this year. What kind of improvements? Examples of improvements that will be eligible for the ERG include, but are certainly not limited to, the following: investments that reduce repetitive touch, like touchless payment systems, automatic faucets or toilets and door kicks, technology to manage takeout or drive-through orders. Improvements that create distance between customers and employees, such as expanded outdoor dining facilities or partitions between workers who cannot be socially distanced. Purchases of items that directly control infection, like PPE, UV sanitizers, or temperature checking equipment. Again, these are just examples, and more specific guidance will be provided at our introductory business briefing tomorrow. I'll provide registration details in just a moment. We'll also be providing additional resources and more specific training as to the application process the week of July 24th. Who is eligible? To be eligible, your business must be registered to do business in North Dakota with at least one permanent physical presence here. Your business must have been viable prior to March 1st and can demonstrate a negative financial impact caused by COVID. Your business must be able to demonstrate how the grant will improve the facility's COVID-19 resiliency, that the grant proceeds will improve business conditions and inspire consumer confidence. And finally, government institutions are not eligible for the grant. So the business briefing tomorrow will explain this process in much more detail. The application for the ERG is expected to open on July 29th, and the funding is first come, first serve for qualified applications. For those interested in learning more about the ERG, right now, there's information on our website at ndresponse.gov after you click on the COVID-19 banner, but also we encourage you to attend a special business briefing tomorrow, Thursday, July 9th at 11 a.m. At this call, you will be provided additional information to assist you in determining if your business is eligible, more detail on the types of allowable expenses, the application process, and the timing. The session is free and open to the public, but you must register in advance. There is a limited capacity of 10,000 people. It is a Teams Live event. If we reach capacity, it will be recorded for later viewing. And we are once again partnering with the Greater North Dakota Chamber to deliver this information, so you can register at ndchamber.com as a non-member. Following this briefing tomorrow and prior to when the application goes live, again, we will be scheduling additional training to walk you through the application, documentation, and other requirements. Thank you for your time. And I'll stay for questions.
Thank you, Michelle. As Michelle said, she'll be available afterwards for questions when we get into Q&A, but thank you for that. Next up, I want to talk about job service and a executive order. And as we work to restore consumer confidence in North Dakota, restoring a strong workforce is an important part of helping to save livelihoods and businesses. And since the beginning of the COVID-19, Job Service North Dakota has received an unprecedented number of unemployment insurance claims. As we know, in total, over 97,178 regular unemployment claims have been filed. An additional close to 20,000 North Dakota workers filed for the pandemic unemployment assistance, and another just over 20,000 filed for the pandemic unemployment emergency compensation. These claims 4 times higher than a normal year. But the filings, as Michelle mentioned, are down significantly from the peak of March 29th, and more importantly, certifications are down 20% since May. So this decline in certifications directly correlates with individuals returning to employment. With more and more workforce returning to the workplace, today I did sign an executive order. It's 2020 08.2, so it's a revision. It ends the suspension of some of the activities that were required before, because during this crush of activity happening that we were driving through COVID, that original executive order said that you could suspend an activity called registration and work search requirements for individuals seeking unemployment as defined in Century Code. And of course, didn't make much sense when everything was shutting down or being required in some cases to be shut down during the midst of the COVID pandemic, to require someone to be trying to reach out to employers for work when those businesses were closed. But now that we're in this position we're in, we're reinstating those. So again, this executive order is rescinding some of the earlier work and resumes the normal requirements that were there. Work search and job contacts provide the biggest positive impact upon reemployment. And as our economy continues to recover, employers are facing a growing need for team members. An effective work search will expose individuals to job opportunities and results in job offers. So with the work searches once again being required, if an individual receiving unemployment insurance benefits refuses a suitable job offer, that individual becomes ineligible to receive further UI benefits, and in fact is statutorily prohibited from receiving unemployment insurance benefits until they've been reemployed unemployed and earning sufficient wages to requalify for benefits. And this takes us back to what unemployment insurance is meant to be for people that are unable to find work. But we know that there are jobs available in North Dakota, and we know that we want to encourage people to get back into the workforce. Job Service has adapted over the years by encouraging internet job searches along with networking and social media. These options remain available, so you can continue to make these contacts. You don't have to pound the pavement with your resume. You can comply with these requirements and do it from home. Those are considered suitable work searches. If you're on furlough from a company that may have furloughed some individuals, then you're relieved from these requirements as long as you're in contact and have an opportunity to get back to a job with your current employer. Registration for employment is a requirement that individuals receiving unemployment insurance creates an account with the Job Service Employment Services Work Search System. This registration includes many of the common items found in a resume, work history, education, demographic information is an important tool in collecting eligible workers in available positions. And this registration can also be completed online. And then additionally, Job Service local offices around the state can often help individuals complete the registration, navigate the system if they're challenged in doing that, and all the local Job Service offices will be reopened by July 26th. The suspension of registration and work search requirements in the earlier executive order was always meant to be temporary, and so again, those are being rescinded effective July 26th. The reintroduction of these requirements will assist employees and employers to return to work to continue in North Dakota Smart Restart. Job Service North Dakota will continue working with individuals receiving benefits on a case-by-case basis to make sure they receive assistance they need, and we're protecting the lives and livelihood of all. We should also note that, as we know, that there was additional federal support of $600 per week on top of the $529 paid by North Dakota. That expires on July 31st, so the timing of this, effective July 26th, also coincides with the end of that federal program, and so it again could be create an economic incentive for people to get back into the workforce, because unemployment insurance was never designed in our country to pay people more than they could working. And so again, we'll find out where we are relative to unemployment in our state when we get into August going forward. But we have Brian Klipfel is here. Thank you, Brian, for joining us. Brian, of course, leads Workforce Safety Insurance, WSI, and is doing Job Service, doing double duty right now. He'll be available for questions as well. On the behavioral health update, which we include every week, again, want to share some positive news here related to $2 million emergency grants related to addressing mental and substance abuse disorders. The state received these grants from the Federal Substance Abuse and Mental Health Services Administration, or SHMSA, and those organizations which receive these grants include Sharehouse Inc. in Fargo, Heartview Foundation in Bismarck, Agassiz Associates in Grand Forks, and the 5 regional human service centers were awarded grants by the Department of Human Services Behavioral Health Division to support the needs of individuals with addiction or mental health during the COVID-19 pandemic. Sharehouse and Heartview will provide outreach, engagement, treatment, and recovery support services for individuals with substance abuse disorders. Agassiz will provide outreach, engagement, treatment, and recovery support for individuals with mental illness. The regional service centers, which are operated by the state of North Dakota in Minot, Grand Forks, Fargo, and Jamestown and Bismarck, were all awarded grants to enhance services by including peer support for individuals with addiction or serious mental illness. These services will be available soon. For more information, behavioralhealth.nd.gov. And lastly, a reminder to all, if you're challenged at all in any way, whether it's behavioral, mental health, financial struggles, just stress in general, there's free and confidential crisis counseling services available to all North Dakotans, also through a federal grant. projectrenew.nd.gov. Visit that website or call 701-223-1510 for information regarding that. And again, thank you to our great our great behavioral health division within the Human Services division that's doing all this great work. We have a good news section which we include every week, and our good news relates to more good work being done by our lab. Dr. Christie Massen is here. She's be available for questions afterwards on this exciting work that's happening. As you know, we hear every one of these press briefings, we talk about the great work that our lab is doing. As a state, when we entered into this, we had no commercial labs within our state boundaries. We're one of the few states that didn't have that. So the workload that was put on the state laboratory as a percentage of tests that are being completed, probably the highest in the nation in terms of people that are leading in testing, and the majority of the testing done by a state lab. So great work to that team and all the folks from the National Guard and others that are assisting as they continue to run 3 shifts a day, 7 days a week at the lab. But in addition to all that work, of course, we know that researchers, doctors, and scientists across the nation are working hard to develop a greater understanding of the COVID-19 virus. Knowledge is power as we deal with this, and a greater knowledge of the virus facilitates how we can improve our ability to respond to it. And recently, the state lab has joined the CDC in tracking COVID-19 in a new way, using very advanced technology to monitor important changes in the virus and better map transmission. In the past, the state has participated with research like this around bacteria like E. coli and Salmonella, but this is the first time a virus was sequenced in our state lab. And of course, this whole area of genome sequencing has exploded in the last couple of decades, and it leads to a whole new opportunity for opportunities for health, public health, and preventative health with the genome sequencing. But it's an expansion of a PCR test. It provides detailed genetic information about the actual components within the virus that make people sick. And the state lab is part of this collaboration with CDC to upload this genome sequence information into the National Viral Genomics Consortium, which will help epidemiologists see the changes in the virus, because we know that just like with the flu, which is also a virus, can change from season to season, and this kind of a virus, which moves, as they call it, zootonic virus, which moves often from wild animals to domesticated animals to humans, and that's been the case. Has been the case with SARS and MERS and with coronavirus. These viruses change, and this genetic sequencing is going to be super helpful. It'll help connect cases, potentially explain why some communities may be experiencing more virus activity. The more samples are sequenced, the more helpful the data will be in identifying the spread at the state and national level. And this turns the PCR test that we're doing every single day into something more than just a important note of whether that test is positive or negative, but it is turning that data into something useful that will help us solve the challenge at a national level. So we're very fortunate and grateful for our team. So thank you, Dr. Massen, to you and your team for being part of this national effort to better understand the challenges we're facing, as well as the opportunity it creates to improve outcomes for North Dakota and citizens around the world. In closing, gratitude comment we want to share. Today we want to share some gratitude with all of you, because North Dakotans have already been through a lot already in 2020. But as I've said a couple of times here today, you've continued your personal responsibility and your actions and remain North Dakota smart, and that has helped us save lives, control the virus, and also save livelihoods. I had a fun hour today, had an opportunity to meet directly in a live meeting with real people, corn growers from around the state. So it's fun that we're in a position to be back to initiating, with appropriate precautions, engaging in some small meetings. So with the corn grower, their board, which represents some of our great ag producers from around all corners of the state. When I say we've already been through a lot in 2020, corn growers in our ag community, I'm reminded about what they were through last fall when we already had presidential emergency declarations related to fall flooding. And I also got a chance to meet a corn grower today who was harvesting last year's crop this week in July. So that's a first for me. Where we're seeing people that are that kind of challenge. As we know, in May, we had, for the first time in the history of our state, we had the more crop unharvested from last year in May than we had new acres planted this year. Think about that metric and understand the challenges that have been. But in addition to that, we throw on top of that COVID, we throw on top of that the recent ruling on DAPL, we throw on top of that the demand destruction for oil and gas. North Dakotans have truly been through a lot. But you're through all of this, through the, this unbelievable set of challenging circumstances. North Dakotans continue to move forward with personal responsibility and with actions to remain North Dakota smart. And so again, our gratitude today goes out to the resilient and perseverant and courageous citizens of North Dakota who've done so much to protect one another. They've been patient during this time to give us, have some of the safest long-term care facilities in the country in terms of the virus and protecting those that are most vulnerable. And in closing with a quote, there's a teacher and author, Eileen Cady, said that gratitude helps us to grow and expand. Gratitude brings us joy and laughter into our lives and into the lives of all of those around us. I certainly know this to be true, and I want to also thank all the North Dakotans who, in the face of all these difficulties, have continued to show gratitude to our state, to your neighbors, to your family, to your friends, and to your country, because that will help us make it through this. We'll be back here next Tuesday at 3:30. And so those that are not sticking around for what I'm sure will be a lively Q&A, then keep doing what you've been doing, which is be North Dakota smart. And thank you for all you're doing to help keep our state moving forward. With that, we'll stand for questions. And again, I want to highlight that we've got Michelle Kommer, Dr. Mason, and Brian Klipfel here to take questions. And I missed who on the jump ball here between Jeremy and Jack. Who had your hand up first? Or deferring? Jack won the tip-off. Okay.
I have two questions, Governor. One, to clarify, is there a task force that will be established for Burley-Morton counties, or are you just looking into that?
We'll consider it if we need to, but right now we're just going to continue with the existing relationships that we have. We got strong working relationships, and of course we're right here. The state lab is here. Bismarck-Burley has been doing a great job of having their own testing sites through all of this, and so we feel we've got good relationships. If the numbers start to climb up, we'll more formally pull together a task force across Burley and Morton. This is a little less complicated. Part of what we had going on, of course, in Cass County was Clay County, because we had a differential in terms of the amount of testing happening on the North Dakota side versus on the Minnesota side, and so there was a need for us to more formalize that. But I think right here that we'll just keep working. If the numbers change, we'll update you, but not a formal task force.
On that note, what makes a county a coronavirus hotspot? Is there a statistic or a definition of what a hotspot is, or is it pretty relative?
Well, you could argue that we don't have any hot spots. We might have sort of lukewarm or lukewarm spots because when we use the terminology in North Dakota, we're sort of comparing some of the lowest counties in the country versus other counties that don't even have any cases at all. And so it's all relative. And so but we do make sense for us as a state to put our attention on the places where we've got the most number of active cases. So it might be a misnomer to call it a hot spot, but we do right now have Burley has the highest number of active. So a little more attention put here. And as I say, kudos to Cass County for driving their numbers way down where they have been. Okay, then I think Jeremy next, then Jacob, then we're over here to Tom, then Lane, and then online. Okay, we're all the way around. Okay.
Governor, the median age of new infections has been dropping sort of nationwide, and particularly in these states that have seen a great increase in the number of cases. I'm wondering what kind of outreach the state is planning to do to young adults or ways to make testing more available to them.
Well, I think there's two elements to this, Jeremy. One is awareness, because the disease may have less physical impact on people that are younger and healthy, the understanding that you can be asymptomatic and being a carrier, again, reaching a generation that we know cares a lot about collective social responsibility. I mean, this is a great opportunity for young people to show their concern for the planet, for their neighbors, for the citizens by making sure they know their status. So we want to, again, eliminate the barriers. You saw us announce today, drive-through testing. We've got public health testing. We're going to have static sites. We've got lots of ways where people can get tested, even if you don't have insurance, and particularly if you're going to be in a position where you're going to be interacting, like say if you're planning on visiting aging grandparents or loved ones that may have underlying health conditions, a really good idea to think about understanding and knowing your status. So education is one component, availability and locations is another one. But as we look ahead, only about 6-7 weeks from now, when schools are coming back, we're already having the planning meetings about how do we gear up as a state to make sure that we've got the testing capacity for when we think about having 45,000 college students coming back, some of them coming from out of state, and how do we think about K through 12, particularly high school sports. So a lot of discussion still evolving, particularly around education, and we'll be highlighting some elements of K-12 next week at our press conference we announced for next Tuesday at 3:30, and we'll also here in July be having a press conference where we're talking about higher education and the higher education work, where there's a separate task force that's working on the higher education thing. But we're going to, I think the communication through education, young people are going to be hearing and learning a lot more about testing as we head back into the fall. Because understand, we have not, as a state, we have not been in a pandemic when we've had all these students in school. I mean, K-12, we disbanded almost immediately, and higher education was all on spring break. That's 160,000 people out of 760,000 in congregate environments living in dorms. And so, like I say, we've got a road ahead of us that we haven't been down yet as it relates to education, and we're committed to getting our schools open and operating in a way that's safe for the students and safe for the faculty, administration, and staff. But testing is going to be one piece of that.
One follow-up there. For the 20 to 40 age group who works normal hours, is there any plan to expand testing hours so that they might be able to go before or after work?
Great concept, noted. I mean, because again, part of what we have to do and so the testing team that's listing, we got to make sure that we've got availability to reach people where they are, both in terms of time of day of the week, and in location. Because like I said, when we learned when we did the drive-through, not everybody's got a car, not everybody's available during those hours. So great point, and we'll make sure we keep expanding those opportunities. Jacob.
Governor, you kind of walked into my question a little bit, talking about education. You said you're going to be highlighting a lot of it next week. However, the president said that he's calling for schools to be open soon, calling for possibly pulling back federal funds if they don't open soon. What role does the federal government play in reopening, or at least what influence has federal government played in this decision making?
Well, given that there's in some elements where there's providing funding, they have a voice, and they deserve to have a voice. I think that part of the debate, which is maybe sort of down in the details, which is not understood in North Dakota, but last spring, when we closed schools, and then within a period of 2 weeks, we're back open, not physically open, but back doing distance education, and all the effort that went into providing that, making sure that every citizen had an opportunity to have broadband access, that everybody had devices, that everybody had an opportunity to do that. I know from other governors, we know from being on, even yesterday on the White House conference call, coronavirus task force video conference call that happens weekly, Secretary of Education Betsy DeVos was on, and she was highlighting places where when they closed last spring, they stopped teaching. And if you closed your schools and then weren't delivering any education at all versus trying to go to distance education, the federal government's got a right to say, hey, look, if you're not teaching and you're not doing the work, then why would we be funding you? And so that's part of the debate that's happening. That debate's not happening here. I mean, we put out guidelines earlier this summer about how to use facilities during the summer. Many states kept their facilities closed all summer. So we're already on the front edge of reopening, and that we already had guidelines for how we were thinking about doing the summer. But again, we have to be, there are students that have immunochallenged. I mean, whether they've got, a young adult with cancer, whether you've got, somebody that's got leukemia. I mean, there's real considerations for a subset of the population, and the same for cooks and bus drivers and administrative staff and faculty, both at the high school and things. So we've got to figure out a way to do this where we can be safe for everyone in the school, but still get people in there and deliver education. And when we asked all the school districts to submit 175, and they did. They had to submit plans, had to be approved by both DPI and by our office. In part, we were doing that because in North Dakota, it's $8 million a day of taxpayer money that goes into K-12, and taxpayers deserve to get a return on that investment that we're making, and certainly our students deserve to do that. So we believe that the context of, if we can keep the positive low numbers, or keep the strong effort going by North Dakotans, we've got as good a shot of anybody of getting back into physical education in the fall. But it'll again, and there are some school districts that have been very proactive this summer, already working on their reopening plans. We'll continue to work with them as we provide additional guidance. Tom?
Governor, I have a question about masks, but first if I could follow up on the education piece there. The Associated Press is quoting Mr. Voss yesterday saying to you governors, ultimately it's not a matter of if schools need to open, it's a matter of how. And then she said this, schools must reopen, they must be fully operational, and how that happens is best left to education and community leaders. So when she says you must do this, is she treading on your water as a governor, and your right as a governor to determine what happens in this state?
No, I don't think so. I mean, I think she's just making an affirmative statement, which I share that belief, that I think that, you know, it's an important part of our it's a part of our fabric of our communities. It's an important part of our future. You know, like they say, you know, the students are a portion of our population, but they're 100% of our future. American Pediatric Society came out last week and talked about how imperative it was that we actually get schools functioning again because of all the social and emotional needs that are supported when people are in school. The McCann Katz, who's the leader of SHAMSHA, you know, the substance abuse and behavioral health, talked about we've got a thing called mandatory reporting, but this is where if kids are in an unsafe environment, the most frequent way that we find out about that is because that they're, you know, getting into school every day and people are finding out about whatever challenges they may be having at home. So there's a myriad of other, again, social and emotional benefits of having functional educational systems, and so I support that. But she also says at the end of that quote that it's you know, best left to local, and we agree with that. I mean, this, you know, states working with the local public school districts is how this is going to get done, because you have to take a look at the context of, if you were trying to open up a school in the middle of Manhattan when the positivity rate was 40%, maybe not such a good idea. If you're trying to open up a school in one of our rural counties that hasn't had a case for 3 months, it's a different story. So there's context of where you are physically and what the physical environment is, and then there's the context of who you're putting back in the building. You know, nobody is saying that we should put a vulnerable adult or a vulnerable student back into a school building. That's why, again, we have to reinvent the approaches. But we can do both. We can deliver education and be safe about it, and that's the challenge in front of us, and I know it's one we can solve.
On the mask, I spent the last 2 days in Fargo, and I was surprised to see that less than 20% of the people were wearing masks. Have you noticed the same kind of thing, and do you feel that the public in North Dakota has spoken as to how they want this reopening to happen and how they are facing COVID-19?
I wouldn't say they've spoken, but I would say that, you know, what we're from talking to other governors, when the numbers started shooting up in Texas and Arizona, mask use went up. You know, when the numbers go down, people have a greater sense of safety, and I think they're understanding that if they're not going to be in close contact with people, that they can choose, you know, when it's appropriate, when it's not appropriate. If you can physical distance, then the need for a mask, you know, goes way down. North Dakota, it turns out there's a lot of places where you can physical distance in North Dakota and not need a mask. So I don't view it as the I view the percentage changes as probably a reflection of the fact that we've been successful so far. I'm sure that if our state was seeing the numbers that some of the other Sunbelt were saying, I'm guessing we'd see mask usage going up, because people have to, in the end of the day, individuals have to manage their risk based on their own health and those of around them. So it's a.
Do you think they're accepting your light touch of government? Do you think the public are?
Yeah, I wouldn't know. I would let other people judge that, but I would say that we've said all along that it's not what government says, it's what people do. And I trust the people in North Dakota are smart. And if someone has got a vulnerable health situation, I trust they're not going to put themselves in a situation to put themselves at risk. I mean, if you're 80 years old and got underlying health conditions, probably not a good idea to be face to face at a bar, for 4 hours with a bunch of people. I don't think we've seen that. But I do think, and people are acting responsibly. Lane?
Governor, you've already alluded a little bit that we've seen Florida, Texas, Arizona, fairly popular vacation states with rising cases, as well as our neighbor to the east, Minnesota. Have you thought about reestablishing some travel restrictions because of that?
Lane, we've talked about that. We've talked about it a couple times every week. And at this point in time, we've decided no. I know that we all love North Dakota and can't think of a better place that you'd want a vacation. The rest of the nation probably doesn't think that. And so we're, the visitors that we do have, I have had a chance. I was out in Medora for some meetings a couple weeks ago. I think that people are coming through from these other states. I think some of them are acting, they're wearing masks, they're social distancing, they're camping, they're doing things. They're coming here because they're trying to, as we say, they're following their curiosity, not following the crowds. So they're getting here to try to get in a space. So I know there's some specific cases where we may have some athletes that are coming in, from Sunbelt states that are coming here, whether it's for collegiate sports or baseball, whatever. We've got an opportunity to test those folks. So and there's not much business travel going on right now. Airline boardings are still down, and so we're not, seeing a lot of what you'd see the normal business travel where you might have people coming and being in close contact in meetings. And so I think a lot of the travel in North Dakota is by, RV, automobile, or maybe they're coming here to fish or camp. I don't think we're adding a lot of risk. And but certainly, if we've got people in the hospitality businesses, the tourist businesses that are listening, that disagree with that, we're monitoring the situation. We're open to it if people think that there's risk associated with travelers coming to North Dakota. But right now, I would think this would be one of the safest places to be. And so let's just keep being smart and encouraging our visitors to be smart also. Danny, online?
Cecile Werman with the Journal in Crosby. Williams County has added 27 cases in a little more than 2 weeks. Now there are several hundred out-of-state workers in the northeast part of the county for energy projects this summer. Is this on the state's radar, and what communication is occurring with these companies to ensure safety and prevent transmission?
Well, I'd say, every case is on our radar because we track every case by county, and I'll just, take this as a additional flag for us to, pay attention to numbers. We know that there's activity that's gone up in terms of actual business activity. That's a good thing because, of course, we've got so little activity. We were down from 60 drilling rigs down to 1. Fracking crews down. Everything was down in our state. And so hearing that we have some activity, I view that as a positive, and we'll just have to be smart about making sure. But again, people that are working outdoors and have an opportunity to distance, as they often do in ag and energy, way less risk. We were much more worried about manufacturing facilities that are indoor where people are, working long shifts adjacent to each other. And so that's something that we pay a lot of attention to that in terms of working with businesses, but we can add this to our list. One more online.
Renee Jean with the Williston Herald. I keep hearing from a growing number of people who say something along the lines of, I don't know anyone who knows anyone that has the coronavirus. This must be some kind of hoax. Are you hearing this, or are you concerned about any type of fake memes circulating on social media? And is there any effort to kind of fight back against these statements?
Yeah, of course, I don't personally spend time on social media. There's a lot of noise, not much signal out there, and it's important right now that in trying to guide the state that we really pay attention to signal. But certainly, I've got team members and others that monitor, and there is some chatter, I'd say some noise out there about that this is a hoax. I think it's possible if you're in northwestern North Dakota to be, or eastern Montana, to be in one of the least coronavirus cases in the planet. I mean, if you drew a map of the world and it included eastern Montana and northwestern North Dakota, that would be the spot where you probably could be and not know anybody. But those of us that A, when I'm talking to all the other governors, or B, where we've got, friends or associates that live in, whether they live in Phoenix or Los Angeles or Seattle or New York, all these people, I mean, all you got to do is know people in other areas to know how devastating this was. I mean, in New Jersey, it's not a hoax that over 1,000 people a day were dying in New Jersey, and so there's just no basis to that claim, and it's just. And so there's a part of that where I don't understand how those things can live and thrive, particularly in today's world of information, because it seems like there's plenty of information. Now, there's also other misinformation, because there's a lot of people that, every day talk about, the growing number of cumulative cases. I mean, let's go back to, elementary school math class. If you have a chart that shows cumulative cases, it can only go one direction, up, because you never eliminate any cases from the chart. So anytime there's a new case, you add it to the chart, and it's like, the numbers are going up and up and up. That's why in North Dakota, it's important that we talk about active cases. And even right now in the Sun Belt, I think there's a lot of, people are, blowing it up in the Sun Belt that somehow that, these, the cases there, yes, they're growing, yes, they're higher than they were, but they are way less right now, having grown from a low number to a slightly higher number. Say, like, again, if you go from 5 to 10, you could say cases have grown 5% positivity to 10% positivity. You could say, hey, cases have more than 100% growth in positivity rate. The New York metro area for a sustained period of time had cases 35, 40, 45% positivity rate. So there's nothing in the Sun Belt happening today that looks anything at all like what was going on in the New York metro area. And so there's a lot of manipulation of numbers to try to tell a story, and particularly in the year when you've got a presidential election, there's a lot of people that want to bend a story in a certain direction. But it's sadly, it's not a hoax. It's a real deal. It's a real pandemic, and we're going to continue here to navigate our way through it in the best possible way. I'm going to work my way back across here, so I'm going back to Lane, and then who's next over on this side? Jeremy, maybe, or no, Dave? Do you have one up? You haven't had one yet. We'll go to Dave after Lane.
Governor, with our rolling average slowly but steadily going up, what is your concern level, and with that, what's kind of the number we need to get to for the possibility of us to regress on the danger index chart?
Well, you had sort of two questions there, and I say slowly but steadily, and what's my concern? The thing that we're going to pay close attention to is when we get in this week past the 4th of July. So let's say if it takes 4 to 5 to 6 to 7 days potential exposure to incubation, then we want to really pay attention to the numbers that come in tomorrow and Friday and Saturday to kind of say, what is there going to be a bump from all of the interaction that people had around the state over the 4th of July? So we'll take a look at that. But if we're at this 2% number, and we're among the best in the nation, there's no reason for us to be thinking about rolling back, but there is a reason for us to pay attention and keep being smart so we don't have to. That goes back to how citizens behave. I mean, the last thing we want to do is go backwards. What we want to do is go forwards, and the path forward, is the North Dakota Smart. I mean, it's just that simple. It's hand hygiene, it's mask, it's social distancing. We do those three things, and I want to say and be smart about how we reopen schools. We can stay open forever if we if we believe it is a hoax and ignore all the rules and drop back, then we could find ourselves having outbreaks. But we would again, I think, what we can do or try to do, we've got the programs in place today, is we'd rather be targeted. I mean, we'd rather close a bar or a manufacturing plant than close a city, and we'd rather close a city than close a county, and we'd rather close a county than close a state. But at the beginning, when it was all unknown, we did a lot of things statewide. Now we're smarter and we can be much more targeted. So again, people that want to keep their business open, keep their school open, keep their church open, keep being North Dakota smart, and you'll be on a path to do that. Okay, I'm going to Dave next, who hasn't had one.
Well, I'd like to ask one of Michelle.
Thank you, Dave. Thank you very much. And also Dr. Mason is here to talk about genome sequencing, and Brian Cliffell's dying to talk about unemployment, I'm sure. Michelle?
I was just curious about following up once the grants are given out. How are you going to follow up to say this was a success or this didn't work so well?
Yeah, thank you for the question. So what we're in the process of doing right now is not only building the online application, but building the mechanics on the backside. So we'll be able to report on dozens and dozens of fields, ranging from which industries received the grants, which communities received the grants, what size business received the grant. And so, as well, we're going to be checking in after the fact to make sure that the funds were spent on the intended purpose. So there'll be a process on the backside. Yes, yes.
I'm thinking about the many small businesses on Main Street, North Dakota, who missed out on previous grants and government programs to help out their people during this time. I think about All the Rage Hair Salon in Williston and Daily Addiction Coffee House in Williston, who missed out, and yet they seem to need it the most. How will you ensure that these small businesses that don't have attorneys, maybe don't even have a banker to go to bat for them, are able to get involved in this ERG program of yours?
Sure. Well, I'll have two-part answer to your question. The first is, as I started with today, the Paycheck Protection Program still does have funds available. So for any business that wasn't able to access those funds the first time around, I would highly encourage the business to check into that. Those resources are available at ndresponse.gov. And again, one of the developments by the federal government over the course of that grant being available was a modification in June to make forgiveness much easier, frankly. And they relaxed the rules about forgiveness, which essentially turns that loan into a grant. So anyone that hasn't looked into that, I would encourage them to do so. And then secondly, the ERG was designed to benefit as many companies as possible. And what I mean by that is that the maximum amount being $50,000 or up to $100,000 if there are more than one physical location assures us that we aren't going to have one organization come in and capture millions and millions of dollars. So that combined with the fact that the application is going to be fairly simple, and the Commerce Department, our team is going to go to great lengths to make sure that the businesses that you speak of have the ability to get trained on how to apply very specifically. I never make the mistake of confusing a small business with an unsophisticated business. I think that North Dakota businesses are very sophisticated regardless of their size, but we're going to make the process as easy as possible for them.
Scott Hennon, KFYR WZFG Radio. Many businesses have invested heavily in COVID-19 protections, but the larger problem is consumer confidence. Even medical community tells us stories about patients avoiding important appointments because of fear of entering a facility. Will these funds through the ERG be available for outreach and marketing programs to boost consumer confidence?
That's a great question. Hi, Scott. As of right now, we are developing and finalizing and firming up the eligibility and ineligibility. And presently, we are not including in the eligible expenses marketing campaigns. However, one of the things that we're looking at doing is helping a business publicize that they were an awardee for this grant. So, while we can never make assurances as to infection exposure, we can help a business by giving it a badge. That's where we're working on right now, that they were awarded this grant and that they made an investment in their business to be safer by investing in infection control measures.
Can you talk to those small businesses directly about what they should do to ensure that they're not left out this time around?
I'm sorry, can you ask the question again?
Could you talk to those small businesses directly who are listening and watching as to what they should do to make sure that they don't get left out this time around?
Yep, absolutely. And I think my invitation to attend the business briefing tomorrow is the first and most important thing. And then to watch the Department of Commerce website and our press releases and announcements and our social media, because we are going to be building resource tools, reference tools, and then the week of July 24th, offering additional training where we will walk the applicant through the actual application, what they will experience when they go online to apply. Again, it is first come, first serve, and so the system is going to manage who gets in first. We're going to be time stamping those applications by the microsecond, but I'm extremely hopeful that there will be enough money for all interested applicants. We're planning 3 rounds. The first round opens on July 29th, and if there is money that continues to be available, we'll do additional rounds. And again, I want to repeat Governor Burgum's appreciation and gratitude to our legislature, because this is a significant amount of money. Our next door neighbors in Minnesota offered a program that was much more restrictive and a much smaller amount of money, respectively. And so we're really fortunate, I think, in North Dakota to have this opportunity. And I'm excited about the improved infection control, the increased customer confidence. And I'm also really excited about being an example for the rest of the nation that we are open for business and we are responsive to our companies.
I have one more if I can. Mike Smith, 660 KUYZ in Williston. Are there any contingency plans at the state level to help local businesses in the unlikely event that North Dakota has to shut down again in the future?
I think I'll probably let Governor Burgum answer that question. Awesome. All right.
The question for Mike Smith is no. Right now, we're not. We're working on doing everything we can to stay open, as opposed to making plans for shutting down again. But I won't let the optimism close out. Because we're dealing with the unknown. We don't know where we're going, but like I said, what Michelle just talked about here, the additional, again, would strongly encourage people, again, the PPP that's remaining available to pursue that. The ERG conference call tomorrow, register at ND Chamber, free online, be part of that stuff, but there's a lot of great programs that are out there right now for people to participate in. Who won the jump ball this time? I think Jeremy got it this time? Okay, all right.
Do you think the high proportion of people being retested every day is deflating the positivity rate? And have you considered reporting a separate positivity rate for people who are being tested for the first time?
We do track those because we have the numbers, so we know how many positives come from the new unique individuals who've never been tested before and the repeat ones. We've looked at how all other states are reporting it. There is some inconsistency, so we've been consistent through the whole approach and how we're reporting, so we're going to stay with that. But from I say operational standpoint, we take a look at that to see. But this is what's helped us, really be successful, say, with long-term care, because we were testing people over and over again in long-term care and testing long-term care workers over and over again. That was, a key element of that. When we're trying to identify community spread, we look closely at the new unique individuals and their ages and where they're coming from to look at that. And of course, it is, if you take a look at the unique individuals, you do get a higher positivity rate. But from an actual statistical standpoint, we feel comfortable with our approach, because if somebody had a PCR test 3 weeks ago and they have one now, and they were negative before and they can be positive now, that's useful information relative to the population in North Dakota on the day we took the test. And so it is an actual reflection of how many positives we're finding among the people that we test on any given day. And that's what surveillance testing is about. That's what we're trying to do. So we feel that, talk to biostatisticians, talk to other people. We feel very comfortable that we've got a conservative and appropriate way of how we're thinking about it. But operationally, we do drill down, Jeremy, and make sure we're not missing anything. Jack?
Question for Dr. Massen about the genomic sequencing.
Way to go. Here she is, Dr. Massen, talk about genome sequencing.
The state got involved in it, and it sounds like you're just sending the sequences of our positive cases to this database, right?
Yeah, we've actually been doing whole genome sequencing for a long time. We previously were doing it on viruses like Salmonella and E. coli, which helped us monitor food outbreaks. So this is actually the first time that we've moved into the world of viruses, and so we've successfully sequenced the virus, the SARS-CoV-2 virus. We actually have 3 different platforms that we test for PCR, and we were able to sequence virus from all 3 of our different platforms, which was also very exciting.
And this is a partnership with the CDC?
Yes, so we generate all the data, and we generate the sequence, and then we send it up through pipelines, and it goes into CDC's database. And that's where that additional analysis by researchers and epidemiologists will occur. Yeah.
For those that were curious, Dr. Mason had a mask on until right before she walked up here. Like a lot of the great folks over in the lab, we got to make sure we don't lose any people in the health lab even for a day. But anyway, thank you. Congrats to the team. And I want to remind people that Brian Clipful is here and General Dorman is here. No, he's wearing a mask but it's not a camouflage mask. I can still see him. So if people have questions for either of those leaders, they're also here. Tom, you have a question?
I want to ask you a question about the Dakota Access Pipeline, how that is affecting state government, and whether you're talking with Washington about that. There's an order now by the court that it be empty, the pipeline be empty by August 5th. With everything else going on, with the COVID-19 and all that, what effect is this going to have economically on the state? And what are you doing to try and prevent it?
Well, take your 2 questions there, or 3 questions, I think. One is, are we in touch with our congressional delegation in D.C.? Absolutely, yes, we are. I've been in contact with all of them this week. Matter of fact, all of them since the announcement on Monday morning. Second question is the effect on North Dakota. It's a devastating effect on North Dakota. And every North Dakotan, you don't have to be in oil and gas to be affected by this decision. It's our largest industry in terms of revenue production for the state. Almost 50% of the revenues in the state come from oil and gas, and that touches healthcare, touches K-12 education, touches higher education, it touches general government services, it touches roads, it touches counties and local cities. It touches things like the Prairie Dog Bill, which is supposed to, provide support for every community in the state. The Water Resources Trust Fund. I mean, so if you are a citizen of the state of North Dakota, you have benefited mightily in the last decade from the oil and gas industry. When you take our primary and lowest cost form of takeaway transportation and shut it down with a single order after it's been operating successfully and safely for 3 years, the impact is tremendous. And we've always been able to ship product out of our state at least 2 primary ways. One is by pipeline and one is by rail. When the price was $70 or $80 per barrel, and you have to shift between those 2 transportation methods, companies can absorb the cost of the higher cost of rail transportation and still keep producing. Right now, we're coming off of an unprecedented global demand shock and reduction of energy, and it creeps back up to $40 a barrel. We know that the industry said if it's above $40 after the 4th of July, that's when we're going to sit down and have discussions about, should we bring back fracking crews? Should we bring back back drilling rigs? Should we, reopen some of the wells that we shut down during COVID? Those discussions are all off right now because of the uncertainty that this has been created. But I want to have people understand the severity over the long term, because capital flows and talent flows to where it can get the highest return. And when we're competing in the Bakken, we're competing against other oil fields around the world and other oil fields around our nation. And if you're an operator, many of the operators diversify their risk by operating in multiple oil fields. So if you take the Permian, down in Texas, New Mexico, if you said, okay, they also had a demand shock, I'm going to bring one rig back, or I'm going to bring 2 rigs back. I was thinking about doing it in the Bakken. Oh, well, gee, now I may not be able to have takeaway. Now I got to use rail transportation. I think I'll put that rig back in the Permian Basin. So this is a blow specifically damaging to North Dakota. I mean, not South Dakota, Minnesota, Montana. This is a direct hit on our state, that this thing, and it hits jobs locally, local communities, the people that support it, the hotels, the restaurants, the bars, the schools, everybody that supports this industry. And so it is, and for me, as someone who spent now close to prior to this, 40 years, as an entrepreneur, creating jobs, making payroll, working in the business sector, the idea that you could have a single judge take any piece of infrastructure, and I don't care if it's a bridge, a road, a broadband, piece of broadband infrastructure, whether it's you name the piece of infrastructure, and our country needs to modernize its infrastructure. Federal Congress is always talking about, we got to pass an infrastructure bill because we got to modernize our infrastructure. You take one of the most modern and most efficient and safest pipelines in America, and that's a fact, and there is an estimated over 38,000 river crossings where oil and gas cross water in the United States. This one is the #1 safest, and it crosses in 2 places in our state, up by Williston and between here in the South Dakota border. And so all of us have a vested interest in clean water and clean air in our state, including everybody along the Missouri, every inch of it, because of where it crosses in 2 places. And so this is basically, in my mind, unheard of, where you would have a single judge be able to shut down a piece of operating infrastructure, because the way infrastructure gets built in our country is not just by tax dollars and governments, it's by the private sector investing in those upgrades. It's by people offering bond issues and private investors investing. That's a positive thing when capital can form and we can replace aging infrastructure, older pipelines and older methodologies. It's a positive thing when you can move a product by pipeline, which is safer and better for the environment than moving it by rail. But if you put together a prospectus to raise capital, and in that prospectus you said, hey, by the way, investor, we could be operating for 3 years, and 3 years down the road, this whole thing could get shut down on 30 days notice. You will never raise a dime for infrastructure in our country again. It will be strictly become a thing where government is doing all the infrastructure. That's not a good thing for the country. It's not a good thing for taxpayers. It's not a good thing for anybody that buys gas at the pump. It's not a good thing for energy security. We finally got to a point after 40 years in our country where we had not just energy security, but we had energy dominance. We could finally start selling energy to our friends and allies versus buying it from enemies. We could finally think about bringing home all of our soldiers and airmen that have been fighting in the Middle East for the last 40 years protecting oil lanes. I mean, we finally were in a position to do that, and then this comes along, and we're going to allow a single judge's ruling, and it's not against the company. This is a judge ruling against the Army Corps of Engineers. He's saying that the Army Corps of Engineers didn't do their job permitting. Who's ever said it was easy to get a permit from the Army Corps of Engineers? I mean, this is an organization that's known for being incredibly rigorous in how they do their permitting process. So we'll see how this thing goes. I know it's been appealed. I would hope for every citizen in North Dakota, and that includes even every tribal member in North Dakota who are also citizens in North Dakota, because they all benefit, and certainly everybody at the 3 affiliated tribes benefits when this pipeline is running. I hope for all of us that we can have continue to have a dialogue about how do we have clean air and clean water, but we do it in a way where we're not killing the livelihoods of our state and all the things that support it at the same time. There's a better path forward.
Can you comment on the deadline of August 5th, how devastating that is, because if they have to empty this pipeline, even if an appeal is successful later on, it's going to cost millions and millions of dollars to back that up.
Yes, it's a pipeline of this length. You know, to empty it and shut it down is very costly. To start it up is very costly. And my understanding is that these things are actually, you know, they're built to be under pressure and full of a liquid. They're not built to be empty. And so there's actually probably enhanced risk in some ways when you empty the thing out or leave it empty for a period of time. So, you know, much better if we're having this debate when the thing is still operating, particularly when it's been operating safely for all the years it's been already operating. Okay. Other questions? One more online, then that's the last one.
Jean Schemp with Hometown Radio Group. Recently in Minot, there was a cluster of positive COVID-19 cases among a group of out-of-state workers living and working in Minot. Will the state consider tracking cases like this where the patient's driver's license may be out of state, but the person is actually living within our communities?
That's one I'll take an action on, Gene, and follow up and make sure that we understand exactly how we're doing it. Because if they listed their address as out of state, they wouldn't show up in our numbers. And so we'll make sure that we're working our way back to make sure if we've got make sure that we're actually, through contact tracing, tracking people that are positive and are here who may be reported in other states. So I'll make sure that we tighten that one up, but thanks for flagging that. With that, I want to again thank you all for being here. We'll see you next Tuesday at 3:30. And again, thank you all in the media for getting out facts, not fear, and keeping the solid information flowing. Thanks to all the leaders that were here from the state of North Dakota for the great work you and your teams are doing. And everybody, and with General Dorman here, thanks again. The National Guard continues to play an important role. I think we've got over 300 Guard men and women that are deployed right now, helping and continue to help on testing and lots of other fronts. So thanks to everybody. It's a team effort. We're all in it together. Continue to be North Dakota smart. Thank you.